Diverticular disease is very common in our society. It involves primarily the sigmoid colon, which would be your left lower abdomen. It causes pain, usually crampy or sharp pain. It can lead to fever, it can lead to abscess formation, and can really make you sick. Well, diverticulosis is just a weak spot or a weakening of the wall of the colon. It causes an outpouching. And just having that does not cause symptoms usually. It's when those outpouchings become infected that it becomes an issue. And after you've had several episodes of these attacks, we call them, or attacks of diverticulitis, the literature would say 3 to 4 attacks. Then it's time to consider surgery. And at that point, we robotically will take out that part of the colon that's causing your problem and put you back together, and usually solves the problem. Robotic surgery in general shortens the length of stay in the hospital. That's its design. It's considered to be minimally invasive, and so what formerly would keep you in the hospital 6 to 7 days now keeps you there 3, sometimes 4 days. You can expect a bowl of soup the day of your surgery and a hamburger the day after your surgery. One of the biggest problems with operating on the human colon, or any colon for that matter, is infection. Infection, fortunately, only occurs about 2% of the time, and that's usually associated with the extraction site, or the biggest incision involved in the surgery itself. After the robotic sigmoid colectomy, I've had patients go home in 24 hours. I've had some want to leave the same day. We've not gotten quite that bold yet. But if you add all of the hundreds that we've done together, the average length is right at 3 days. If you have recurring diverticular symptoms, or you know that you're having these symptoms, you want to seek attention, seek your doctor, because many times it can be treated with just antibiotics and dietary rest. But if it becomes a more persistent problem, everybody would need a screening colonoscopy leading up to the surgery to determine the extent of the disease, and then they would come see me usually to discuss the actual procedure itself. So if you feel like you have diverticulosis, or you know that you do, and you've had recurrent diverticulitis, you can call our office directly, Carrollton Surgical Group, at 770-834-3336, or you could see your gastroenterologist or even your primary care physician to kind of get the ball rolling and get started toward getting better.